From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
Welcome to You Should Know. I'm your host, Evelyn Ledbetter, and today my guest is Stephanie Johnston, and she's a radiographer, along with being the First Lady of ENMU. So Stephanie, great to have you back again.
Thank you.
I know we did a segment on this not too long ago, but this is great information, and breast cancer awareness is just around the corner. And I think that's a really important topic on education, and so appreciate you being here.
Thank you. Thank you for having me back. I love to talk about all things mammography. So,
well, you've done this for a lot of years.
Yes.
And how many years have you been involved in this field?
27 years I've been doing just mammography.
And you shared something before we went on, talking about being asked, "Is this all you do?" All day long, and you were talking about the certification and thing that goes with this. Can you tell us a little bit on that?
Yes, so mammography is the only radiology medical imaging modality that is federally regulated. So we have some very high standards that we have to meet as far as education, continuing our competencies, and meeting all the requirements for quality imaging. So there's a lot that goes into it.
And I know the acronyms after your name, but you're certified in the modalities as far as?
Yes, radiography, mammography, breast sonography, and bone densitometry.
So there's a lot of training and education that goes into this.
Yes.
You had actually brought some stats, and this is a little overwhelming. Do you want to give them, or do you want me to?
Go ahead. Go ahead.
This is enough to make you want to go in every year for that treatment. Breast cancer in the U.S. is the second leading cause of cancer deaths after lung cancer. The amount of that in deaths among women is just staggering. It's increased since the year 1990. It's just increased. It's projected 300,000 women and 2,800 men diagnosed with this breast cancer in 2024. Yes. So typically it's touched somebody's life that you're friends or family or someone with.
Typically, and if it's not a friend or a family, somebody that knows somebody, you're not very far separated from that.
That it's going to touch you. Yes. And along with women, definitely the fact that this is something that affects men as well.
Yes, it does. Yes, it does.
And I'm sure that may be the ones that are overlooked for a longer period of time.
It is. Oftentimes, men don't necessarily pay attention to what's going on with their breasts and, think it's nothing. Right. It'll go away. So typically by the time we see those men come into an imaging center, it's a little further along than what it would be if you were a normal screening patient, like a woman that should come every year.
Right. And the importance on that, catching it early.
Absolutely, yes.
And so doing these tests, I always get in trouble when I go to my physician, and if I'm a little late on those, and she's like,
they shake their fingers at you.
But I need that. So let's talk about, what are the risk factors for cancer?
Yeah, so there are two types of risk factors for breast cancer. There's those that you cannot change and those that you can change, that you have some control over. The top two risk factors for breast cancer in women are being a woman and getting older. So can't change either one of those.
I always say that I'm getting a little more seasoning on myself. I guess I'm that perfect candidate.
More seasoning, yes. But the average age of breast cancer is 62. So yes, as you get older, your risk just increases. Other things that you can't change are, your genetic predisposition. Some of the things that you can change, though, are obesity, being overweight or inactive, especially after menopause, or drinking alcohol, and then your hormones, too. Your hormones play a lot of a big part in breast cancer, and that's why you see women getting breast cancer and men not, only about 2,800.
Okay.
Because it depends on the type of breast cancer, which a lot of people don't know. There's many types of breast cancer. So men get a different type generally than, not different, but there is a type of breast cancer that men get that women can get, and that's usually what you see in men. It doesn't have anything to do with hormones.
Genetics also?
Genetics, yes. Family history. those types of things, when you begin your period, when you end your period, and how many pregnancies you've had in between there. That's why they ask those questions on a health history.
Is that because of the difference of the changes of your hormones as you go through menopause?
Yes, it's the amount of hormones that your body gets over your lifetime. So if you start your period late, then you don't get them maybe for 4 or 5 years before someone else. If you were 16 and somebody started at 11, they're obviously getting them more.
Okay.
You have a break when you're pregnant, so however many pregnancies you have gives you a break from hormones. And then when you go through menopause, if you go through late menopause or early menopause, or if you're taking synthetic hormones.
Right. I knew that the supplements was a big thing because the cancer, is this right? It feeds on the estrogen is a big deal.
And not every cancer does, but some do.
So
Yes.
when you take hormones, that can be something that you just really need to discuss that with your care
Absolutely.
provider and
Yes.
decide if that's right
Yes.
for you.
Yes.
Because if it does increase some, and smoking, does it have an effect?
It
Just in
does,
general?
but it's not really listed as one of the key ones. Really, the biggest ones are the inactivity and the obesity that you can change.
Okay.
Yes.
I did not realize. I knew they always ask those questions on your health form when you go in for an appointment, but I had no idea that's what they were looking at for the amount of pregnancies and the start of your menstrual cycle.
Yeah, and it's, I always tell ladies, when they're filling those, if they're filling them out for the first time, I'm like, I know you didn't come planning on taking a test about yourself, but we need to know that information. The radiologist looks at that information every time they interpret your films and stuff like that, just to kind of see where you are. And a lot of facilities will do a risk assessment, and those numbers plug into a risk assessment program, for your risk for breast cancer. And then if you're over a certain amount, 20%, I believe is the threshold, 20% risk, then it's easier for you to get supplemental imaging if necessary, such as MRI and stuff like that. Your insurance generally, most of them are turning to where they will do the supplemental imaging if you're in high risk category.
Well, it just seems it makes sense if you can provide that preventative care. That's going to be a lot less expensive
Absolutely.
than the long-term care if you actually
Absolutely.
are diagnosed with.
Which is the importance of mammography.
It's not. There's a reason that it's not. Is this all you do all day? You literally are saving.
Yes. So mammography is the easiest, cheapest, fastest way to screen the masses. So to screen as many women as possible and try to find cancer when it's as small as possible. And the exam itself it doesn't take very long. It takes about 15 minutes. Sometimes it takes you longer to fill out the history sheet than it does to actually do the mammogram. But it is the gold standard. That's where everyone starts, is with a mammogram, a screening mammogram. And even if you're having a problem, you start with a diagnostic mammogram. But the screening mammogram is what they do on as many women as we can. And the importance of having one every year is that on the mammogram, on the imaging, you can see very, very subtle changes from one to the other. They compare your old one and your new one and look for small little changes. And that can determine whether or not you would then need to have a biopsy to sample that and see if it is in fact a cancer.
At what age are the screenings usually started?
They generally start at 40. Most providers, most provider organizations, the American College of Radiology, they all follow this start at 40, have it once a year. There are some other entities that say that you can wait till you're between 40 and 50, you can go every 2 years, that you can wait and start until you're 50. But most providers do not follow that, and we don't follow it at our institution.
Why wait?
Correct.
The simplicity of that exam.
And, women are getting diagnosed earlier and earlier before that 40-year-old screening age. So you really have to be in tune with what's going on with your body and have those clinical breast exams, do your self-breast exam. I always tell ladies, who do you want to know your body the best?
Yes.
You want yourself to know your body the best. So pay attention to what's going on and the changes that are going on. I have never had a woman that could feel what turned out to be breast cancer that didn't know that it was different from the way her breast normally felt.
Right.
So they knew it.
I know I had a situation where I could feel something, but it didn't show up on the mammogram. They did a sonogram. We did some other testing. Finally, it was just a piece of cartilage that had popped out between my ribs lifting a tree.
Yes.
When I was planting it. But that follow-up, it's scary.
Yes.
But yet you go, man, this is something that wasn't there. And you keep noticing that should not be there.
And the reason you knew that was because you knew what your breasts were normally. So if you know what they are when they're normal, if you're of age where your breasts change with your cycle, understand the way your breasts feel when they're not in cycle and out of cycle, and in cycle. And then you will know when something doesn't belong there.
Well, I've even read where some people are going to the point, if it is something that is from a family member or extreme cases for generations, and literally choosing to have a total mastectomy and just saying, I don't want the risk of this. So that's pretty radical, but...
It is very radical. And you will see that even now with individuals that are have the gene mutation tests, and that is a prophylactic treatment for... because if you have that gene marker, your risk significantly increases, and so they'll do actually a hysterectomy and a mastectomy.
Wow.
Yeah.
So you get to decide which is more important to you.
Sure.
And everybody, that's a real personal choice. Sure. But again, talking to your healthcare providers and information like this today is so helpful. There was one lady I knew. She said it was where they had red streaks. She started seeing red streaks in herself. Can you talk a little bit about?
Yeah, so some of the things that you want to be looking for are any kind of changes on the outward appearance of your breast. So those streaks like you're talking about, if your the areola around the nipple and areola change colors, or the nipple inverts, or even a dry, flaky, rashy type thing that doesn't seem to go away. That can be a type of breast cancer called Paget disease. Usually has an underlying breast cancer, but it's a kind of an outward appearance when you find it generally. Any kind of discharge from the nipple.
That's what I was going to ask.
Yeah, obviously if you can palpate something, feel something, and then we've had cases where ladies come in and they're still just, I don't know what this is, and they have an erosive breast cancer that's already come through the skin. That's obviously waiting till the very last minute, and we want to see you long before that.
Do you think part of that is just not wanting to know? They know something's going on, but the thought of facing the treatments and thing is just overwhelming.
Yeah,
or so scary.
I do think that. I think, they're scared. They don't know what's going on. Sometimes we can be our own worst enemies too, because I literally had a patient this week. It was her first mammogram, and she was so scared she was shaking, because she had heard so many horrible things about a mammogram. And, while it is not the most comfortable thing to have done, it's one time a year, and it takes about 15 minutes, and it can save your life.
Can you talk about exactly how you need to prep and what is done during that screening process?
Sure, yeah. So the first thing you're going to do is your test, your history sheet. Once you get that filled out, like I said, that goes to the radiologist so they know what's going on with you. The patient's going to change generally. Most places, you just need your from the waist up off. So that is not the day to wear a dress.
No. That's true.
Yes.
And I know they say no deodorant.
No deodorant, and no, you can put lotion on, just make sure that lotion doesn't have glitter or something like that in it.
Does it distort?
It shows up as small little calcification looking things on the mammogram. You know how they say deodorant has aluminum in it? It's a metal. And it shows up on the imaging.
I did not
know.
Now
it's very distinct when it is under the arm. We know exactly what it is. But it can flake down onto your breast, and lotions with glitter in it can show up. And so we just want you to come in clean and stinky.
And then if you're kind of nervous and perspiring some, it just, just increases the
comes
aroma.
with the job. Comes with the job.
And literally, I know it's changed from like the soft, you talk about the paddles where it's literally you compress the breast tissue.
So the breast then is put on the detector, which is the part of the machine that absorbs the x-rays. The breast goes on that, and a paddle comes down and compresses it. What that does is it spreads the breast tissue out. Now, that's for two things. One is to make the breast thin and uniform, not thin like a pancake, but the same thickness all the way across, so that you're getting the least amount of radiation when the picture is done. The other thing is to spread out the breast tissue. So what that does is it kind of spreads everything out so the doctor can look through there and see better. Things in the breast that are growing that are not supposed to be there, they don't spread out. They stay in one place, so when you spread the other tissue out, they're seen easier.
Then it makes it where it just makes it thinner so you can see that?
Yes.
And what about breast implants? Is that an issue of going ahead and having exams?
It is not an issue. We still do many ladies that have breast implants. Breast implants do entail 2 sets of imaging. So you're going to get one set of imaging where we will pull the whole breast and implant out, apply a light compression on there because we don't want to damage the implant, and then we will take the exposures of those. Now, what we're looking at in those, because we are not spreading out the breast tissue, we're not compressing that breast tissue, what we're looking for is the integrity of the implant. Okay. Is there anything going on with the implant? Is there a leak or, anything that's
because that obviously has been linked to some other issues from the implant and the material it's made
out of.
And
then the second set of pictures is where we gently push the implant back and compress that breast tissue, spread that breast tissue out, let the doctor see what's going on there. And it sounds like it's an awful thing, but most women tolerate it very well.
I know the joke, when you tell somebody and they always, they give the little cartoons with it, looks like you've had a bookend, and everything's been flattened, and, and you just laugh about it.
Well, the breast bounces back, so. And I always tell them, I'm going to squeeze you one way, and then I'm going to squeeze you the other, so you'll be fine when you leave.
Well, talk about also dense tissue. I don't understand everything on that.
So dense breast is a radiologic term. It's what your images look like after they've been taken, the X-ray images. It's not how they look hanging on your chest. It's not how they feel. It is a term that is applied once the radiologist sees your images. Now, density shows up on the breast, on the medical imaging as white areas, but so does breast cancer. So if you're very, very dense, you have a lot of white tissue in your breast, it's more difficult to see a breast cancer. That, again, is the importance of spreading that tissue out, because then those are really going to be where the radiologist can see them.
So those exams may be a little more intensive, but still, they're not
painful. We really
painful.
don't change what we're doing as far as the compression and that type of thing. Some ladies that are thick-breasted or just generally tender, they might have a little bit more discomfort than other ladies. Some ladies, they're just like, yeah, it's fine, go ahead, type of a thing. But back to breast density, the FDA has made some amendments to the Mammography Quality Standards Act, and that will go into effect on the 10th of this month. And those requirements, the 2 really important things for women is that the radiologist in their report has to determine 1 of 4 levels of density to the provider. So it'll go in the report to the provider what level of density they have. And then the patient will get a letter stating that they are dense or not dense. So they will know what's going on. And the reason for that is to give the patient and the provider the information about that woman so that if supplemental imaging is needed, then they can move forward with what they need to do. And by supplemental imaging, I'm saying another modality such as ultrasound, MRI, contrast-enhanced mammography, those types of things.
The advancements in those testing, I'm sure, have came a long ways from when you first got into this field.
Yes, they are. So that supplemental imaging is not the same thing as being called back from your mammogram. They're 2 very distinct things.
So don't get super excited when you hear this, just ask questions.
Definitely ask questions. The reason for it is to generate those questions so that patient can go back to their provider, look at their risk factors, look at their history, see what is going to be the best thing for them moving forward.
Okay. Well, and the awareness of this has become, it's not so taboo to talk about it, whereas years back, The things we're saying today on this program would not have been talked about so openly.
Right.
So, but there's so much on this. So we've talked about the family history. Let's see. We talked about symptoms. Tell me about the Breast Cancer Awareness Month and how that came about.
Breast Cancer Awareness Month came around many years ago when a woman, again, diagnosed with breast cancer, those tend to be the leaders of everything, wanted to raise awareness about what was going on and, this disease and how it affected women and things that could be done to mitigate it. And the pink ribbon became synonymous with it. So you'll see that pink ribbon throughout the Breast Cancer Awareness Month. And then it's just kind of blown up into this whole, you will see pink everywhere in October.
Well, obviously you see, even to the point of sports teams are wearing
yes,
men and women.
Men and women.
Pink shoes and
yes.
jerseys and
I love
everything. It's everywhere.
Yes, it is. It is. And, it's interesting. It's not just to raise awareness about breast cancer. It's also raising money for breast cancer research.
Right.
It's also celebrating the more than 400 million people that are living now that have gone through and are going through breast cancer treatment. So this is a disease that affects a lot of people, and bringing that awareness and raising funds and celebrating the women that are afflicted,
sure,
as is a great thing to do.
Have you ever been involved in putting an event together?
Multiple times, yes, over my many, many years.
I'm guessing that it was. And those events, there's a lot of different ones. I know I've seen walkathons and
yes.
And what all else? There's a lot.
Yeah, so you'll see generally like Susan G. Komen Foundation does the run, walk type things. You'll see bowling tournaments. Now pickleball is so popular, you might see pickleball tournaments. One of the things that I did several years ago when my mother was still alive, and she was very helpful with this, is we actually put together a Riding for Pink open horse show.
Oh, that's perfect.
Yes, kind of combining my two passions.
Your passion together.
Yes. So, and it was so much fun because we did a couple of things that were really fun. We did a costume class where you dressed you and your horse up in anything and everything pink. So that was a lot of fun, and it was judged by the audience. So.
We should have made all the students and everybody today wear pink, shouldn't we? And I didn't even wear it. So you did, and you've got your pink ribbon on and everything, so you did well.
It was fun too because all the ribbons that we gave out for the event. It was a horse show. We judged it, but all the ribbons were pink.
Oh, that's fun.
So it was a lot of fun,
cool.
And we raised good money and had a good time. And
we don't have a lot of time, but something else to talk about when someone is diagnosed and they're going through treatments, the support system.
100% important.
And how will people go about it? I know information is so much more readily available, and you can do that, but to get involved with a support group, just reach out and find out, is there a site or something that gives us?
There's many sites. You can Google it and see what you can find online. Certainly check with your mammographer or your facility where you're going. American Cancer Society has a lot of support that they can help you with. But probably I would say the best support is your partner, if you have one. Of family and friends.
You need someone.
You do. I can tell you for myself, doing this for so many years, if I was the one sitting on the end of the table getting that information, what I would choose to do for treatment changes based on my support system.
And sometimes in those consultations with your physician, someone there with you may hear something different or interpret it versus when you're the person that you're dealing with, you're not objective.
And I worked for a breast surgeon, and he encouraged them to bring someone with them to hear what he was telling them. And, because you'll have options.
Right. And I'm sure there's support groups for the caregivers as well.
Absolutely.
That's a huge part of it because you're scared for them. Maybe you not want to show all of how scared and how that's affecting you.
And you'll get those directions for those individuals and other things, support things for women or men if they're going through it, also from a cancer treatment center.
Our time just goes like crazy. I knew I had put way more information than we would ever need.
I told you it'd be a lot.
I know, but good things. I learned a lot. I didn't know the reasoning behind a lot of the things for those exams, and just get involved and be aware. And
yes, and I'll just tell
yes,
you,
please.
Roosevelt General Hospital is planning something for our area. I'm not entirely sure what it's going to be, but we are in the works of planning something for breast cancer
And I'm
awareness.
sure that's common.
Yes.
Through different facilities.
Pretty
sometimes.
much, most facilities that do mammography.
Well, Stephanie, thanks for sharing this information. And I, if it touches one person and makes a difference in their life, then it's very well served.
My motto.
Well, thank you.
Thank you.
And for all of you watching today, thank you. And we will catch you next time. Cheers.